Hello everyone, I am Dr. Jeenam Shah. I am a consultant pulmonologist, that means a chest physician, practicing in Mumbai. Today we are going to be talking about asthma, a very important topic. Before starting the video, please subscribe to my channel and press the bell icon to get regular updates. So what causes asthma? Asthma is a complex interaction between genetic and environmental factors. So you must have noticed that a lot of families have asthma which are there. Some children may develop it, some child may not develop it. So it's a complex intervention where there can be some patients who develop it, some patients may not develop it, and environmental factors are many, which we'll be discussing later on. And apart from that, there are a lot of host factors like prenatal factors. If your mother was smoking during pregnancy, that can be a risk factor. If mother's birth weight was very low, your birth weight was very low, it can be a risk factor. There are some perinatal risk factors also. So there is something called as breastfeeding. If you have been a breastfeeding baby, then the chances of asthma is lesser. If you are a premature delivery, then the chances of asthma is more. Even vitamin D deficiency is known to cause asthma in childhood. So we spoke about prenatal factors, we spoke about perinatal factors. Now I'm going to be speaking about the postnatal factors. Those are predominantly childhood factors. So the first factor is airway hyperresponsiveness. So a lot of kids, when they are born, generally whenever they get an infection, they develop hyperresponsiveness, they develop a lot of wheezing. So that is one of the factors. Second factor is patients who are having atopic eczema, that is, eczema over the skin areas. Generally in childhood, this develops in small kids, predominantly because of food allergies. Those are also a higher risk of developing asthma. Another factor is allergic rhinitis. So children who are having persistent sneezing, runny nose, whenever the weather changes, they have all this kind of symptoms, or whenever an infection happens, they have symptoms which are prolonged for a long period of time. Those are also kids who tend to have asthma later on in life. Apart from that, there are a lot of environmental factors which we'll be listing it out. So we spoke about the host factors, which are the prenatal, perinatal, postnasal factors. Now we are going to be speaking about factors which are not in control of one particular individual. Those are the environmental factors. So environment is a trigger for asthma. So there are two triggers. One is the genetic, which is an inbound for the patient, and second factor is the environmental factor. When both of these two come together, you have a problem. I am genetically prime, I am more likely to develop asthma. But if my family or anyone in the family does not have asthma or any kind of allergic tendencies, I am less likely to develop asthma. So when these two things come together, I have a problem. Correct. So environmental factors we start about with indoor allergens. So most common thing is house dust mites. Those are small kind of organisms which are there on your pillow, bed sheets, pillow covers, which crawl over your night, and when they lay their waste products, that is when you get allergic tendencies. That is why generally you develop late night and early morning symptoms in asthma. Apart from that, a lot of other indoor allergens like molds. Those are the fungus which are growing inside the kitchen sink, in areas where there is wet bathroom areas generally. Those are also allergic too. Apart from that, pollens which are there particularly in the environment. Different kind of pollens, different kind of trees which release their pollens, which goes inside and it triggers an allergic reaction. That is why generally it is something which is seasonal. In some season you'll have some X pollen, in some other season you'll have some Y pollens. Apart from that, insects like cockroaches or any other bed bugs and all those things can also trigger asthma. Indoor air pollution is a very important factor. So when you talk about indoor air pollution, you talk about smoking, which a person is smoking indoors can lead to asthma, trigger asthma. Then there are cooking oil, cooking gases, which can also trigger. Agarbattis, very very important factor, particularly in Indian settings. Agarbatti smoke, which is very very toxic to a respiratory tract, it can also trigger asthma. Very important allergen trigger is infections, respiratory infection. Any infection, whether it is viral, bacterial, or fungal, when it goes into the respiratory system, it triggers an allergic reaction. That is why you have increased wheezing. Third component is extremes of emotion. You might have noticed whenever a child has an exam or there is some event that has happened, generally the child will have more symptoms during that time. So extremes of emotion is known to trigger asthma. Extremes of temperature. Suddenly you are in an AC environment, you go out which is hot, suddenly you change your temperature, it can also trigger asthma. Smoking is a very important factor of asthma. Whether it is a first-hand smoke or second-hand smoke, a person around you is also smoking, which is called a second-hand smoke, and you are inhaling those kind of toxic fumes, that can also trigger asthma. GERD, that is gastroesophageal reflux disease. anything which is coming from the esophagus, that is your food pipe, into the upper airways, that can also trigger asthma. Obesity, that is people who are on a heavier side, the weight is on the heavier side, those people generally tend to have more severe asthma. So very important component is outdoor pollution, right from factories to vehicular exhaust to all the construction work which keeps on going on. They release a lot of chemicals, whether it is sulfur dioxide, nitrogen oxide, carbon monoxide. When you inhale those kind of agents, triggers asthma. And there are some medications like beta blockers, ACE inhibitors, which when consumed, or NSAIDs, which when consumed can also trigger asthma. So today we spoke about what actually is asthma, how common is asthma in the entire world as well as India. We spoke about what are the risk factors and what are the triggers for asthma, specifically genetic and environmental factors coming together to create problems. So if you have any further questions, you can definitely contact us. We have the number which is written here, and we would be happy to answer any of your queries.